How to stop taking Effexor. Effexor and Effexor XR are the brand names in the United States for venlafaxine, an antidepressant pill that is used to treat millions of people. Effexor is prescribed by doctors to treat depression, anxiety disorders, as well as panic disorder. Because Effexor is prescribed, it is important to follow your doctor's instructions for taking it. This includes the time you and your doctor decide it is best to stop taking the drug. By gradually tapering your doses and relieving any withdrawal symptoms you may have, you can stop taking Effexor, tapering your doses. See your doctor. No matter what you do, you should always consult your doctor if you feel you should stop taking Effexor. While you might feel better or even need to discontinue the pills because of pregnancy or another condition, going off Effexor cold turkey can have serious consequences. Talking to your doctor can help you make an informed decision about alternative treatments or quitting Effexor altogether. Avoid stopping or tapering off Effexor until you speak to your doctor. Continue to follow the instructions your doctor gave you when he or she prescribed the medication. Tell your doctor the reasons why you want to stop Effexor. Make sure you are completely honest about your reasons so that your doctor can consider the best treatment options for you. You may have a wide variety of reasons why you want to go off Effexor, from feeling better to pregnancy or breastfeeding and other drug interactions. 3. Make sure to listen to your doctor's suggestions. Ask questions if you have them, including the benefits and risks to stopping the drug as well as if there are alternatives to the doctor's suggestions. You can always get a second medical opinion if need be. Give yourself time. No matter how long you've been taking Effexor, give yourself plenty of time to stop the drug. Although it's tempting to just stop altogether, this can cause difficult and uncomfortable withdrawal symptoms and may make you feel worse. Depending on your dosage, you'll need to give yourself anywhere from 1 week to several months to stop taking Effexor. Based on your condition and dosage, your doctor can help you formulate a rough estimate of the time you'll need to stop taking Effexor. Plan your taper. You'll need to reduce your dosage of Effexor slowly. There are no hard and fast rules of how best to plan your taper other than to work with your doctor to individualize it to you and your body. This means that how much you reduce your doses and at which interval you do so can vary greatly depending on factors such as how you feel and withdrawal symptoms. Take 1 to 2 weeks to taper off Effexor if you've only taken the medication for less than 8 weeks. If you've been on Effexor for 6 to 8 months, you should wait at least 1 week in between dose reductions. For those people on Effexor for maintenance, taper much more gradually. For example, don't reduce the dose by more than 1/4 every 4 to 6 weeks. 6. Write your plan on a sheet of paper or in a notebook where you write other things such as your mood or problems you encounter. For example, you can write a plan that says, starting dose, 300 mg, first reduction, 225 mg, second dose reduction, 150 mg, third dose reduction, 75 mg, fourth dose reduction, 37.5 mg, 7. Split your pills. Once you've spoken with your doctor and have a plan, you'll need to make sure that your dose is proper to your plan. You can either have your doctor prescribe you a specifically dosed pill, have the pharmacist split your pills, or even split the pills yourself with a commercially available pill splitter. If you are taking Effexor XR, you will need to switch to regular Effexor. This is because the XR is an extended-release pill, and cutting it in half affects the mechanism by which the medication is released. This means it is possible to overdose, because too much will be released at once. 9. Get a pill splitter from your local pharmacy or medical supply store. Ask a pharmacist or staff if the product will suit your needs for splitting your pills. Monitor yourself. As you taper off Effexor, it's important to monitor your mood and physical symptoms as you reduce doses. You may even want to make a weekly assessment of how you feel. This can alert you to possible problems or if you should more gradually go off of the drug. Keep a weekly diary as a part of your plan. Note your doses and how you're feeling. If you're feeling good and have few withdrawal symptoms, you can continue to taper off according to your schedule. Remember to not accelerate your plan so that you prevent possible withdrawal symptoms. 11. Consider keeping a mood calendar for each day of the week. You can rate how your mood is on a scale from 1 to 10 daily in order to identify problems or recognize patterns in your symptoms with dose reductions. 12. Stop the taper if necessary. If your symptoms get worse or you experience severe withdrawal, consider stopping the taper. You can always add back half your dose or all of it until you feel better again. At that point, you can continue reducing your doses at a smaller rate. Stay in touch with your doctor. Throughout the process of tapering off your Effexor, it's important to keep your doctor informed about your progress. Let your doctor know if you have setbacks or experience withdrawal. Your doctor may suggest a new plan or alternative treatments to deal any setbacks you may experience when stopping Effexor. If you have difficulty getting off Effexor, your doctor may switch you to fluoxetine Prozac. Then you can taper off the fluoxetine without experiencing the withdrawal symptoms.